Hi everyone, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about insurance companies, medical healthcare insurance companies. You're probably like, what are you going to talk about with them? Because you have tons of videos that talk about other more specific topics. Yes, you are correct. But I've never done, I feel, a very broad discussion about healthcare, medical insurance companies in general. I was reading a Becker's report the other day, and the data is from January of 2024, but I felt like it was pretty relevant, and it was just something that I was like, this is very interesting. I'm sure it's a little bit different now since we're almost a year away from that data, but it doesn't mean that it's not good to know and kind of keep in mind, especially when you're operating a practice, you're opening a practice, you have your own practice, because I was like, oh my gosh, like I know it, but I didn't know it, if that makes any sense. So, per the Becker's report, the largest payers in the nation, so we're talking about like United Healthcare's, Blue Cross Blue Shield, stuff like that, are 10 times bigger than the size of the largest health system. So if you let that sink in a little bit, that is kind of making sense on where we're kind of feeling things going when it comes to reimbursements and how the insurance companies are like, not wanting to pay, and they're kind of butting heads with us entities, healthcare entities. And I know the hospitals feel the biggest effect of this because they get reimbursed less than your non-facilities, but also there's a bunch of other bureaucracy stuff that goes on because they can't turn people away if they're a public hospital. And I mean, there's so many regulations and stuff when it comes to the hospitals, but 10 times bigger than the size of the largest health care systems in the nation. It's like, oh my gosh, like that really puts that into perspective. Like I knew they were big. Like I said, I know how big they are, but I didn't really know how big they are. Like that really puts it into perspective. 10 times bigger. I mean, that's significant. And because of this, they have the negotiating power. And so there's like this imbalance, right? And we all are feeling it. If you own a practice, run a practice, work in a practice, and you see the reimbursements and you see how they're going down, and you hear your patients always mentioning how stressed they are about trying to pay for their insurance and their deductibles and their prescriptions and stuff like that. It's really stressful, and you're like, oh my gosh, how did we get here? Well, these healthcare insurance companies are growing, growing, growing to the point where they're kind of bullies, I guess you could say, or they're the kings. They dominate, right? They dictate. And so you get this imbalance of negotiations, which I have also seen over the years just with small private practices, where you used to be able to negotiate initial contracts when you contracted and credentialed with insurance companies. And now they're like, nope, it is what it is, take it or leave it. Like they don't even care because they're so big, there's so many other people, and they know that there's going to be someone else in willing to take that spot, that they're just like, take it or leave it. And so I think this is to bring awareness to all of you that if you get a contract that you're not happy with the reimbursement, you don't have to take that contract. You could decide not to see those patients. And yes, that's very unfortunate for the beneficiaries of that insurance. But once that trend catches on and they're like, I can't find a doctor to take my insurance, they're going to go, I need to change my insurance. And then when they change their insurance, that insurance company is not getting their money anymore. And they're going to feel it. And I know this is a slow progress, and it's been going on for a long time, but you don't have to. I have patients that there's one insurance in particular, Cigna, that's pretty low for a commercial reimbursement. And a lot of the practices are like, not worth it. We'll tell Cigna patients they can pay self-pay if they want, or they can go somewhere else, unfortunately, but it's not worth that lack or that less of reimbursement compared to everything else. And you totally have that right. You just have to make sure you communicate that to patients up front and let them know what their opportunities are at your practice if you don't bill their insurance. So, those are some things to keep in mind. The other thing is that they are the largest entity in a least competitive area. So the largest in the least competitive area paid hospitals 15% less. So where it's not super competitive for them, but it's a big area, they paid them less because they're like, man, we don't have to compete with anybody else. They'll take what we're going to give them. So we're going to pay them less than we do in other places where it's more competitive, but maybe a smaller market. And, I get it. That's a business strategy. I understand, but I don't respect it, right? So we have also been seeing an increase in denials and reimbursements grow. I can't tell you how many times I see a new denial and I'm just like, are you kidding me? Like, what? Why is this a thing? Or when did this become a thing? Or why? This makes no sense. And it delays your payments. And then you're playing the game of, is it even worth billing? Or we can't offer that service anymore unless it's a cash service. And I mean, there's all these things that ends up disrupting inside the practice because of these growing denials. And it's just like, we all know the goal is not to pay, but I mean, it's gotten a little ridiculous, but now it totally makes sense, right? Because they hold the power. And you are not alone that you are feeling this. When I saw this information, that's why I'm doing this video, because I'm like, oh my gosh, this is why so many practices still need so many billing and coding staff, because they keep changing the rules, moving the goalposts, if you will. I'm a sports person, as you're playing the game. And it's really hard to keep up with everything else in healthcare that's always evolving and changing. And so with the denials growing and the reimbursement declining, we're also seeing payments coming in slower, especially the end of the year right now. I mean, that's across the board. It's been that way forever, especially from government insurances because they're running out of money, right? And then it's costly to have to resubmit and rework these claims if you're even going to get paid. And it's inconsistent. Like, you never know what day one insurance is going to change their mind or how one insurance is going to do something from the other. So you're not alone if you're having the same frustration. It's known out there for a while that, we're just kind of playing this game and trying to make do. And I just wanted to do this video to have this dialogue, even though I know you can't talk back to me right now, but I would love to hear in the comments how you're feeling and how you guys are dealing with this and how you're flexing with this and trying to handle this, because it's hard. And I hear the anxiety, I hear the stress, I hear the frustration from a lot of people on a daily basis for exactly these reasons. And so I just don't want you to feel like you're alone. And then my last point that I want to bring up is, I thought was very interesting. United Healthcare, or Optum, uh, is the largest employer of doctors and advanced practice practitioners, APPs, like mid-levels, of the world. Like, they are the largest employer of doctors and mid-levels across the world. An insurance company, Optum, UHC. And I know they have a bunch of different lines of service where they offer different things. It's not just insurance, but really, like, think about it. It's like, holy moly. I had no idea, but it totally makes sense. But again, it's just so bizarre to me. But anyway, I'm getting off topic, kind of. I just want to bring this to your attention, that if you're feeling the pain of denials, rejections, that you feel like you can't keep up with the changes of the insurance companies, if you feel like your cash flow is less because of it, or you're having to hire more staff to help, fix that stuff faster, you're not alone. Something's got to change. I don't know what the answer is, to be completely honest with you, but please, misery loves company, I guess. Know that you're not alone. People are observing this, they know about this. And honestly, we need to get our bureaucrats involved. We need to let them know. We need to, come down on these insurance companies, and we need to let our patients know. And I have always been very honest with patients when we have issues with their insurances, with getting authorizations or referrals or services covered or whatever it might be. I'm very honest and say, you need to call your insurance company. You need to advocate for yourself. Patients have to advocate for themselves. They have to be educated about their insurance. They need to understand the insurance. And that's our job, to try to educate them. So start there. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with all of your colleagues whom you feel would benefit from hearing this. Thank you so much for the support, and we'll see you next time.